The coronavirus, tornadoes. What's the role of the federal government? Hi, I'm Scott Ott, and this is Bill Whittle Now. And this episode of Bill Whittle Now is brought to you by the members of BillWhittle.com, as well as our friends at the Patriot Post, who have a new free primer on American liberty that you can download when you subscribe at the Patriot Post. We'll provide a link in the description section below. Bill, as you well know, the cases of coronavirus and deaths from coronavirus are slowly swelling even in these United States. And at the same time, as we record this, we are a day after a tornado hit in Tennessee. And as of this recording, the latest death count from that is 22. And our thoughts and prayers and frankly, our money go out to the people in Tennessee. But Bill, it struck me that as a conservative, we should or do have an idea of what the role of the federal government should be when it comes to disasters like this, whether it's a health disaster or a natural disaster, as they call it. And Bill, first of all, let me ask, do you see any difference between the role the federal government should take in dealing with coronavirus for vis-a-vis something like a tornado in Tennessee?
I do, and it's a great question, and let's try to answer it in kind of detail. First things first. Both disaster relief and disease prevention are two things that governments are supposed to be there for. This is why you have a government. This is one of the primary features of government is public health. And when I say public health, I don't mean telling you how much you can have, how big your soft drink can be, but coordinating the activities that we all share in common in the common sector, in the common square outdoors, is precisely what government should be doing. And the more prepared the government is for these kind of things, the better I like it. So this is one area that a person who tries to be as true to conservative principles as I understand them, and I'm constantly being educated on them further by other conservatives who are watching the show. It seems to me that without question, this is exactly what the kind of thing that government should be doing. And I wish they were doing an awful lot more of this stuff and spending more money on this than on the other stuff they're doing, like trying to tell us, how what temperature we should set our house thermometers.
Bill, I don't know that this was always the case, though. I remember recently, last year or so, reading a biography of Calvin Coolidge, who came under a lot of pressure to provide federal funding for disaster relief for a flood that I believe happened in his home state. And he said that that's not a matter of the federal government's responsibility, that in fact, state and local people should be taking care of that for themselves.
Now you get me to my second point. And all of this follows from principle. So I'm trying to start at the base and work my way up. Disaster relief and public health is a function of government. It is an appropriate function of government, and it's one that I think virtually every conservative would support, because we're not anti-government, we're anti-state, and we want the government to be as small as possible. And this is one of the things the government should be doing alongside defending us from foreign enemies and so on.
Can you clarify what you mean by anti-state?
Yes, there's a difference between a government and a state. A government is a group of people, relatively small group of people with limited powers whose domain is only the areas outside of our personal interactions. It's the area of the public square. It's things like defending the country from everybody in the country gets defended by the federal government. Efforts to control yellow fever outbreak are an appropriate response of a government, and these are what governments do. The state, on the other hand, is a replacement of the entire idea of the individual by the idea of a collective. A state is a moral and philosophical and economic construct that people bow down and worship like a golden calf. And a state is bad, and a limited government is not only necessary, but it's good. So yes, government has a role to play in natural disaster relief and also in public health issues like containment of infectious diseases. That's number one. Up higher now on the argument, now that we've got the idea that government should be doing these things, we now come to the second point, and that is, should this be the responsibility of the federal government? And my response to that should be, it depends. If you're talking about tornadoes in Tennessee, then that should be the responsibility of the state government of Tennessee to the degree that they can handle it. If a natural disaster in a state becomes overwhelming, and a hurricane like Katrina would be a good example of that, where the damage is so widespread and so severe that it utterly overwhelms the ability of the state to respond, then and the system usually works pretty well this way. There are legal procedures in place. These legal procedures are not designed to slow down relief to people who need it. They're designed to keep government control over our lives to a minimum. And so if Tennessee has a serious tornado, that should be Tennessee's problem to solve. If on the other hand, Louisiana gets hit with a tornado the size of Europe, and Louisiana although some of those, Andrew was essentially a 30-mile wide tornado. But yes, a hurricane. Yeah. Hurricane hits the state of Louisiana and overwhelms the ability of the state to respond, then it is appropriate for the federal government to respond. But if the governor of the state files a formal request for federal assistance, and the request clearly states that we do not have the facilities or the resources to take care of this on our own. Therefore, we are bumping our responsibility upward with a specific, limited request for federal assistance in this case. That's how it's supposed to work, and most of the time that's exactly how it works, and that's perfect. So this is the argument for disaster relief, like tornadoes and floods. Yes, the government should be helping with this kind of thing, and yes, it should be held down to the lowest level, county level if it can be done, then state level. If the states get overwhelmed, a formal request from the governor to the president saying we require federal assistance for this, and if it's reasonable, it'll be granted. And I've never seen them not be reasonable. So far, so good as far as disaster relief goes.
Now, hang on. Bill, let me just qualify this for you, though.
Sure.
Because this is a key issue. Because I don't know of a state in the union that, when struck with something of a magnitude of a tornado, which frankly is about the most precise natural disaster that you can get.
It's well said.
You can map it by zip codes.
Extremely localized. Yes. Yes.
So, but none of those state governments would call up the White House and say, "Hey, I heard you on TV with your thoughts and prayers for the people of Tennessee. Thanks a lot for that. Just wanted to let you know we've got everything taken care of here. Don't need any of that federal money. We put away a bunch of extra money just in case there's a huge disaster like this." I can't imagine any of that happening.
No, I can't either, but that's how it's supposed to work. And the only way that it would work would be to have a president who had the guts and the principles to say, well, Governor, we will start our relief. This is what I would do if I was the president. Okay, we will begin to move our federal relief resources into place immediately based on your request, because we're not going to let people die while we argue about this. But I will tell you this. If it turns out that you had the resources to actually deal with this, we're going to bill you. We're going to bill you for it. If this was a false alarm, in other words, if you're just calling for federal relief because you feel like you could get it, I'm not going to argue with it on the phone while people are drowning. I'm going to start sending in army relief and so on. But you had better justify this, because if you don't, not only am I going to bill you for it, I'm going to make sure the American public knows that you're being billed for it. That's how it's supposed to work.
But every one of those governors would say that every function of state government is currently underfunded, and therefore we have no pennies that we can spare for anything additional.
Well, then,
by its nature, a disaster is additional.
Fantastic. Well, we're talking about how the government was designed, not how the government works. But since this is a very, very fun thing to role play, my response to that would be, well, then, Governor, you're going to have to take better care of the finances of your state, because if your state of a Tennessee, which has an economy the size of something like France or Italy, if you are not able to put together enough resources to resolve a terrible disaster in an area that's probably 10 miles square, then you have some serious issues in your own state economy, and we'll talk with that. We'll talk to the press about that as well. That's how it's supposed to work. So I'm talking about theoretically, because this whole thing is a theoretical argument.
Sure.
Now let's get to public health and things like infectious diseases and so on. Now this clearly is the job of the federal government. Clearly, viruses and mosquitoes do not pay any attention to state lines, and there is nothing about an infectious disease. You talked about, and it was a very, very good point. You said a tornado is about the most precise disaster you can get. Correct. In terms of total destruction. It is in about as limited area as you can get. Fires are more widespread, earthquakes, hurricanes, all of that. Tornadoes, very specific. So a tornado is a great example of something that should be the responsibility of the state. But even if the single case of yellow fever or smallpox or COVID-19 or whatever appears in any state, you are now talking about a phenomenon whose ability to spread is, depending on the disease, either extremely easy or tougher. But in either case, it doesn't matter where this disease lands within the purview of the United States of America, within the legal boundary of the United States of America. An infectious disease, by its definition, is something that will spread, and it doesn't matter if it lands in Seattle, and it doesn't matter if it lands in Miami. This is now a national problem because that disaster moves and grows. Unlike a hurricane or anything else, which usually when it hits landfall begins to weaken, earthquakes do their damage and then they stop, fires spread and then they burn out. A disease is like a fire that continues to spread, and it will spread as long as there's human fuel. And that is, without question, the responsibility of the federal government. Now, as it turns out, the Center for Disease Control is one of the organizations in the federal government that I think, to my knowledge, I would have to say of all of the hundreds and hundreds and hundreds of government organizations, I think I have more respect for the CDC than any single other one of them. I really do. That is precisely, exactly how the government is supposed to function. CDC is not telling me that I should be washing my hands when I come out of the bathroom. CDC is not doing any of those things. CDC is dealing with cultures of extremely deadly viruses, learning how to deal with them, contain them, prepare vaccines for them. But much, much more importantly than that, CDC is constantly, daily, 24 hours a day. Nobody gives these people the credit for this because we only hear about CDC when there's an outbreak. But the Center for Disease Control on a 24-hour, minute-by-minute basis is looking not only around the country, but around the world. And if they get a report that somebody's got a spike fever and their tongue is red and there's a bad infection in the back of their throat, that report goes to CDC and CDC immediately starts saying, is this scarlet fever? Is it possible? And this is why we get so absolutely overexcited about things like the coronavirus. By the way, there are so many different types of coronavirus. I'm just going to call it what it is. It's COVID-19. It's coronavirus 19. COVID-19 is what I'm going to use from now on because I don't see any reason to perpetuate vagueness and
Sure.
inaccuracy.
So, Bill, there are two elements to federal government, well, at least two elements of federal government involvement in something like this. Number one is funding, and number two is actual practical control, human resources,
Yes.
in command, directing
Yes.
activities. And it seems to me that there is often a distinction between those, because I know, having worked as an elected official at the county government level, that there's a lot of disaster response stuff that goes on even at the county level and certainly at the state level. And a lot of times the federal government is essentially funneling money from not only the federal tax coffers, because it's not just current tax revenues, it's future tax revenues. So they are essentially taking on debt to fund these activities that they then leave in the hands of local authorities. With something like that cross-border COVID-19 idea, do you think that the federal government should hold on to the reins more than they have been?
In regard to what?
In regard to actually directing activities, channeling resources, having their people on the ground, for example, in Washington State, and is usurping the role of the state government.
Okay, good question. Let me just build on the previous point just a little bit because it kind of goes to this too. I knew there was a second government agency. I couldn't put my finger on it. One of the agencies that I admire the most in the federal government is the Center for Disease Control, and the other one that I admire unabashedly, and I haven't a single bad word to say about it, is the National Transportation Safety Board. That's not the Department of Transportation. I have a lot of problems with them, and it's not Homeland Security, and it's not any of that stuff. But the National Transportation Safety Board is essentially the mechanical equivalent of what CDC is for biology. biology. What CDC is for biology, NTSB is for mechanical failure. And the reason I love the National Transportation Safety Board, the reason I love them so much is because that government agency sits inside its office and doesn't grow or expand. All it does is its job. And when a plane goes down, it doesn't matter if it's a jumbo jet, and it doesn't matter if it's a Cessna 172 Skylark. When a plane goes down, NTSB is there within a few hours. They have these constantly ready teams, and people think, wow, we haven't had a plane crash in it's been 20 years now. It's an inconceivable commercial jet crash. And that's true. But CDC is out there every single time.
NTSB.
I'm sorry. Thank you. Yes. NTSB is out there every time a guy flies a Cessna into a tree. And furthermore, NTSB is all around the world. Anytime a jet goes into the ground in Madagascar, let's say, if they request the help of the NTSB is there because they're absolute experts. And here's the thing I like about the NTSB more than anything. They are 100% apolitical. They don't deal with politics. They don't care what Boeing has to say. They don't care what Cessna has to say. And they don't care if it turns out that it's a failure of the government of Ethiopia. NTSB is there to determine what happened and to make recommendations so it doesn't happen again. And I don't want to go too long on this, but these two agencies are crystal clear examples of what a government can and should be doing. So your question is, should the federal government be pushing down more aggressively? And I think the answer depends on the case. If it turns out that we see an outbreak of, let's say, something like German measles, and CDC is aware of it, and CDC notifies this. Say there's an outbreak in Atlanta, so CDC then should which I think is where CDC is actually. So CDC then says to the Georgia State public health officials, "Looks like we got a problem here. You want to take a look at this?" And CDC should be on the scene monitoring this stuff. And then, frankly, the direct answer to your question, I believe that to the degree that the state is handling the situation well, then the federal government steps back. If the state is either not handling it well due to incompetence or due to lack of experience or due to lack of resources for whatever reason, then the federal government should exert more control and more coercion. But again, all of this stuff that we're discussing is theoretical because theory is important. You can't build a structure of any kind, a mechanical structure, without a plan. And you can't build a government without a plan. And you can't build the plan until you know what you want. So what I want is I want to be left alone. And at the same time, I'm more than willing to give a percentage of my hard-earned money to a group of people who do limited jobs that no one else can do. And in the case of accident investigation, public health in terms of infectious diseases, and relief from natural disasters, these are things that not only I am willing to fund, but I am willing to increase the funding on. If you think about how much money gets wasted, just wasted, forget about entitlement programs and all that, just plain sheer waste. If that money were to go to CDC labs to develop, you can't develop a vaccine against influenza. And that's why COVID is so infectious, because influenza by its nature mutates so often. What you can do is you can do a great deal more in-depth research onto actual viruses, how they mutate, what causes them, and how to suppress that aspect. And to the degree that I do believe in limited cases that federal money should be spent on research, in limited cases, pure research, this would be something that I think is believe it or not, underfunded. And while I certainly won't want to see a tax increase because so much money is being wasted elsewhere, if I had the means to direct the federal government's river flow of money, I would cut most of it back and give it back to the people, but I would divert more of it to these agencies that are not only doing the job they're supposed to do, but they're doing them in exemplary fashion.
If you haven't downloaded your free copy of the Patriots Primer on American Liberty, you're going to love its view of principles and history tied together. And we encourage you to get your copy by going to the Patriot Post. There's a link in the description below.
And you help us. I'm sorry, Scotty. And just so you know, you help us out when you do that as well. They're great guys. We wouldn't be doing these promotions if we didn't have high respect for them. But it financially helps us as well. So that's just something else to think about.
And we appreciate you taking any and all motivation to do that. We think you're going to enjoy the result. For the members at BillWhittle.com, we say thank you. If you've not yet become a member, that's real easy to do. Just go to BillWhittle.com and click that Become a Member link. You'll unlock new levels of engagement with comments and a member-written blog, as well as backstage content that you don't see until you become a member. So for Bill Whittle, I'm Scott Ott. Thanks for watching.